October was actually World Mental Health Day, and the main theme for the celebration had to do with mental health in catastrophes and emergencies. And I mentioned a little bit of what I picked when I first heard this topic. Let's hear from you, coming from Basic Needs Ghana. What does this theme mean?
So, first of all, let me extend my greetings out there to survivors of various disasters that have happened in Ghana, conflicts and other emergencies. We can immediately think of a conflict in the Solar Tuna area, right, where children are scattered at the Boku areas.
Right.
Of recent ones, the Volta region floods, people are still recovering from it. The June 3rd disasters.
Twin disasters.
The Apiache explosions, the Kantamato market fires, and several other similar disasters. I just want to extend greetings to all survivors and families. Of course, a very recent the plane crash that affected the dignitaries of the country.
Right.
All of these are situations that still sit very much in our hearts, and we just think that whilst our team for the mental health 2025 sit directly, access to mental health in emergencies and catastrophe, I thought we should just reflect on these incidents in Ghana.
Right.
Now, Basic Needs Ghana, it's a mental health development and advocacy organization that have been operating in Ghana for the past 22 years.
Okay.
And our work focuses on enabling people with mental health conditions and their families to live and work successfully in their communities. We do this by influencing policies that ensures the prioritization of mental health across all sectors. Just like we can speak of mental health in emergencies, we can speak of mental health in unemployment, we can speak of mental health in education, we can speak of mental health in almost every sector that have one way or the other a stressor on our mind. Mental health cuts across. But this year, we are focusing on looking at mental health in catastrophe. How prepared are we as a country in making sure that in circumstances like this, we are able to integrate mental health in our response that we do? So this is what we are looking at for this year's World Mental Health Day.
Right. That is quite impressive and good to know because I was telling Mr. Osman earlier that the event that was held in collaboration with Vint and Alethea yesterday with the Mental Health Authority and other stakeholders brought on board a wide range of stakeholders. I saw personnel from the Ghana National Fire Service. I saw personnel from the National Disaster Management Organization, NADMO. I saw several other agencies that come together whenever there are issues of disaster, whenever these people meet to rectify a certain, whether natural or artificial disasters that come. And so again, it brings us to the issue of intersectorial management, an effort whereby every relevant sector comes on board and play their part. But it is very important that they do not work in silos. There must be synergies in whatever they do. So I asked Osman, I posed to Osman how or who the government agencies they work with are. So I'll pose the same question to you, Basic Needs. Let's know some of these government agencies you've worked with so far. How has it been going forward? What more would you wish these agencies can do, or other agencies can come on board?
Yes, thank you very much. Currently, Basic Needs is a member of the Interagency Working Group on Emergencies. The Interagency Working Group on Emergencies consists of various UN organizations and other civil society organizations, as well as the National Disaster Management Body, that is NADMO. In this agency or working group, what we do is to assess every emergency situation that we are confronted with, bringing on board the integrated dimensions. If you look at the structure of the Interworking Agency Group on Emergency, we have the World Food Program on it. We have the World Health Organization on it. We have the World Vision on it. We have NADMO on it. So this team bring on board all the various aspects, like you said. These are cross-cutting issues. Where there is hunger, there is likely to be psychological burden. Wherever there is unemployment situations in times like this, times of losses, wherever there are deaths. So we work together. Let me give an example. When we had this flooding situation in the Volta region, we immediately had to activate this working group. And what we did first was to undertake a rapid assessment. And we go in with a checklist to assess various aspects of the situation. When we speak of water, hygiene, and sanitation, that's WASH, how have the people been affected in this regard?
Right.
When we speak of food, when we think of peace and security, we think of health, and then mental health and psychosocial impact of the people. So this working group's assessment gave us a very fair idea of the various aspects that people were affected with, and then how people can be called upon, stakeholders could respond to these crisis situations. So currently, we do have this interworking agency group in which Basic Needs is actively part of.
Great. That is quite good to know. But moving on away from this working group, what more do you wish? Could there be some policy to further strengthen your work?
Yes. So, in fact, yesterday we released a press statement as Basic Needs and on behalf of the Alliance for Mental Health and Development in Ghana.
Okay.
And in this press statement, we highlighted certain key things that we think can be strengthened in the country as far as mental health is concerned, particularly. In a broader sense, like Osman cited, the situation of mental health right now is very bad. We have a treatment gap of about 90%. It could be more. What that means is the proportion of people who need mental health care services and are not able to get it are about 90%.
That is quite
huge.
Huge.
So
yes.
I could say less than 10% of the people who need care actually get mental health care.
So in simple terms, when you take every 10 people who have mental issues, only one
person is able to access
health.
Mental health care, yes. And so going beyond that and now diving into issues of emergencies and catastrophes, it is even worse. Because at the moment, we do not have a framework, a national framework, that sufficiently integrates mental health experts and professionals into responses. And yesterday's program, NADMO did alluded to this fact, that they do not, or they've not sufficiently integrated mental health and psychological considerations in their responses.
Right.
The first thing we think of when this strikes are the physical ones, the ones we are able to see, the distractions on the ground,
right.
The hunger, the physical health conditions.
Right.
But we forget that
beyond
that
yes.
is when we now begin to feel the psychological and the mental health impact. Right. That if we had responded to them sufficiently much earlier, we would have prevented a lot of mental health problems that we see in our homes, we see in our workplaces,
right.
and then we see
at large in the society. Right.
And I just want to also add that when we talk of emergencies and then these catastrophes, it is not only limited to those ones that are happening in large scales. It could be at the individual level.
Okay.
And so there is that need for deliberate awareness at the community level. You have had someone who has lost a son in a motor accident. It is a catastrophe.
Right.
It's an emergency. What are we doing beyond the mourning and the burial to make sure that we continue to provide community support, that support network in our homes for such people? So that is what we are looking at in our press statement. Right. That first of all, we should have that integration, that policy framework and responses to sufficiently deal with emergencies, the mental health and psychosocial that are associated with emergencies and conflicts, disasters, and so on and so forth. We expect NADMO to going forward, take these into considerations in their policies. And we hope to work together to come up with these policies and raise awareness, particularly that beyond the burials that we do, beyond the treatment of our scars and our wounds, lies deeper in our minds, in our hearts, that no one sees. And so there need to be that deliberate effort to support ourselves during circumstances like this.
This brings me to institutions like religious institutions. We have churches, we have mosques, and we have other places people resort to for some of these psychosocial support. In your line of work, have you engaged some of these institutions?
Yes, so I should mention that Basic Needs work largely by way of collaboration. Collaboration is a key component of the model that we work with. And religious leaders and traditional leaders are very key collaborators in the work that we do. The first point of call for most people in Ghana from our line of work in our engagement with communities, when one experiences a mental health condition, is to consult either a traditional healer or a spiritual healer. And so that should tell us that spiritual leaders are key in mental health responses. And so we collaborate closely with our prayer camps, our religious bodies, our traditional healers, to make sure that we provide rights-based care.
Right-based care.
Yes. We acknowledge the role of religion in providing mental health and psychosocial care, but there's a need to look at it from right-based perspective, And we are speaking of it that way because we have experiences where people go to prayer camps in search for mental health care, and you are chained, which is against the mental health law of the country.
Right.
You are forced into fasting. These are all inhumane. And so there's a need to build that capacity of religious leaders and acknowledge the work that they do so that they're able to provide whatever care they are providing to complement mental health services in the country.
I am particularly excited about the term right-based care, because no matter what you do to us as Ghanaians and Africans, there is that aspect of us that will always run to a higher deity. And we believe in the God Almighty, whether Christians, whether Muslims, we believe there's a supreme being. And all other religions actually all believe there is a supreme hand at work in what we do. And so there is the need really for the same correlation, collaboration, and